So today we will be talking about some facts about SLE. So these are the notes that I made. So I'll just be telling out some of the important points about SLE, and I hope that it helps while you solve the questions for the USMLE step 2. So the first one is that SLE is associated with anti-Smith antibodies. So S for SLE, S for Smith. Second one is it's related with Libman sac endocarditis. So what that means is that there is the vegetations that you have in endocarditis are going to be sterile vegetations. There's going to be no organism there. The third one is going to be it can cause acute interstitial nephritis. So this is one thing that you can just remember in the back of your mind. And remember, SLE and kidneys are very important. So what is the most important nephrotic syndrome that is associated with SLE? Nephrotic is membranous nephrotic syndrome, and your nephritic is going to be diffuse proliferative glomerulonephritis. And what is the most common cause of death in SLE? It's going to be first cause is going to be renal, then it's going to be infection, and then it's going to be CVS. So remember, renal is very important, and then it's seen in middle-aged females, it's seen in African American or Hispanics, and SLE is going to affect the early complement proteins, so that is important. And whenever you have any flare-ups of SLE, you can use steroids. And it's a very important risk factor for accelerated atherosclerosis and premature coronary heart disease. So any person who has SLE has an increased risk of accelerated atherosclerosis. And let's say there's another scenario where there is a patient who has history of SLE and he's coming to you with epigastric pain that is provoked by exertion and relieved by rest. This is atypical angina. And because we are using a lot of steroids in SLE, they can have osteonecrosis, and they can give you another case wherein there's a woman who's coming to you with acute psychosis and arthralgias, and the platelets is low. Not only platelets, even your WBCs as well as your RBCs will be low in SLE most of the times. And she also has proteinuria plus hematuria. So this is going to be your lupus nephritis. So this whole thing is going to be SLE. Remember, SLE is an important cause for acute psychosis. And the next thing you do is renal biopsy, of course, for the lupus nephritis. But in general, when you have SLE, you have to go for ANA, and if it is ANA positive, you can go for the other antibodies mentioned here. I hope this helps. Thank you.